Monkeypox has reached another 3 countries since last night's update.
Tonight, Germany, the Netherlands, and Israel are all reporting it as this global outbreak expands. Let's take a look at how widespread this is. There are 143 cases in 13 countries. Right now, Europe is the hardest hit, with Spain looking into the possibility of super spreaders infecting dozens of people.
The United States has 2 cases under investigation. One is a confirmed case in Massachusetts. The other is a New Yorker whose test results came back just hours ago from the city's lab. Patients in this outbreak have not had any travel links to Africa, where monkeypox is native to wild animals, but genetic analysis made public just hours ago makes it clear that this outbreak is linked to the epidemic in Nigeria, though with a few genetic changes.
Tonight, disease control experts are working to understand how monkeypox could do something like this for the first time ever. So THV 11's Ashley Godwin asked the Arkansas Department of Health how they're preparing and what we need to know.
We're not making all the connections in the UK and in some of the other countries where it's been seen. So that is what is more puzzling and a little more concerning.
Monkeypox is a virus that causes lesions or pox on the skin. It is contagious through close contact and sometimes through breathing.
The main way it's spread appears to be through close contact. I mean, like direct physical touching. So skin to skin contact with someone who has it or is developing it.
Symptoms of the virus include the lesions, which will show up as sores on the skin, similar to chickenpox. Other symptoms can include fever, lethargy, and muscle aches. There have been no cases under investigation in Arkansas, but the Department of Health has prepared a response plan if one pops up. ADH will begin contact tracing of individuals who were near the infected person.
Give them precautions, make sure they're still well, not having symptoms. Give them a few precautions of things to avoid and monitor them regularly to make sure they're not developing disease.
If an Arkansan needs to be treated, ADH will request antivirals or vaccines from the U.S. Strategic National Stockpile. So, should you be on high alert for this virus? ADH says not necessarily, but be aware of any symptoms that arise.
What's the right thing to do if you think you have a rash? That might be it. Talk to your doctor, talk to your healthcare provider. Give them a call, say, hey, I'm a little worried about this. They can talk you through it to see if you have any of the exposure risk factors.
In Little Rock, Ashley Godwin, THV 11 News.
Thanks so much, Ashley. Now, the CDC expects to identify more cases here in the U.S., but at this point, it's hard to say just how many.
Well, one thing that's pretty clear, with roughly 150 cases worldwide, this outbreak is serious, but it is not a new pandemic.